Welcome back to Drug Talk, everybody. In today's video, we're going to be going over all the information that you really need to know about Dabigatran or Pradaxa. So Dabigatran and its active metabolites are competitive direct thrombin inhibitors which prevent thrombus development. Now, before somebody was to use this medication or be given this medication, there are some precautions that the medical team or the patient should be made aware of. First off, this medication is on the Beers criteria, which is the list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to elderly patients with a creatinine clearance less than 30 milliliters per minute due to a lack of evidence in terms of efficacy and safety. Also, we would want to use this medication very cautiously, again, or avoid it in patients over the age of 75 due to an increased risk of gastrointestinal bleeding when compared to warfarin. Significant and potentially fatal bleeding has been reported. This is more common in elderly patients or patients in the labor and delivery unit. And it's actually also more common in patients that are also using other medications that may increase the risk of bleeding, such as antiplatelet drugs, heparin, or NSAIDs, also known as non-steroidal anti-inflammatory drugs. In all of these situations, monitoring would of course be recommended, and dabigatran would be stopped in the event of pathological bleeding. For patients using this medication who have renal or kidney impairment, there would be an increased risk of bleeding in these patients. This is mainly caused by an increased exposure to the medication. Dose adjustment or discontinuation of dabigatran is recommended in this situation. Patients and health teams should also be aware that invasive or surgical procedures would increase the risk of bleeding, so dabigatran should be stopped or the benefit versus risk should be weighed carefully. Now, once somebody is made aware of the precautions and they're cleared of them, there are also some contraindications that they should be made aware of as well. If they have any of these contraindications, they would not use dabigatran. It would be contraindicated in a patient who has active pathological bleeding. Patients with a medical prosthetic heart valve would not use this medication. And of course, like most medications, if a patient had a hypersensitivity reaction in the past, they would not use dabigatran. Once a patient is cleared of the contraindications, our next concern is how is this medication dosed? So the dosing of this medication really comes down to the indication what is being treated with dabigatran. For example, with most cases surrounding atrial fibrillation, to prevent cardiovascular accidents, we would typically see 150 milligrams given twice daily. Another example would be if somebody was having a total hip replacement and we were trying to give this medication for postoperative deep vein thrombosis prevention, they may get 110 milligrams a couple hours after the surgery and then use 220 milligrams for about 28 to 35 days. So once somebody starts using this medication, the next thing they should be concerned of that we're going to talk about here is side effects. Less than 1% of patients may experience a heart attack or myocardial infarction using this medication. A gastrointestinal hemorrhage may happen up to 1.6% of the time, but again, depending on what indication is being treated and what dose you're receiving. Some patients may experience upper gastrointestinal bleeding or anaphylaxis, like we mentioned. Some patients may experience an epidural hematoma. An intracranial hemorrhage may happen 0.3% of the time. And lastly, some patients may as well experience alveolar hemorrhages. That's all we're going to discuss today about dabigatran or Pradaxa in this video. But before you go, I wanted to quickly let you know that you can pick up a copy of my new book, the 5th episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.